Thank you everyone for being here this morning. We have some exciting people here that are enthusiastic about what we want to share about the pilot we've been working on. As many of you know, our city, we're very proud of this, based on the fine work of the people standing with me, to be a national leader in a health-focused approach to combat the crisis that we all know way too well, and that's the fentanyl crisis. We're the first city in the country where firefighters and EMTs can administer Buprenorphine, which is, of course, a life-saving medication for opioid use disorder. So far, 11 firefighters, EMTs, and 38 paramedics have completed the training needed to administer this medication, and it has been administered to, my earlier note said 47 patients, but as of yesterday, 48 patients in the field through the end of November. This is life-saving and life-correcting work that we are doing collectively, and we are very proud of this. We realize this is the kind of effort and the kind of policy and the investments needed, again, to save lives. This pilot program gives our first responders another tool to save lives, bringing treatment and care right to where people need it most and reducing the strain in our emergency rooms. You'll hear a little bit more about that from some of our speakers. We know that by alleviating a person's painful withdrawal symptoms, the program can also create an opportunity to engage these human beings in a conversation about treatment services, getting them on a path to recovery. We build relationships with people who are in need of help. Research has found that administering buprenorphine after a non-fatal overdose reduces the risk of another overdose by over 50%. Research from Johns Hopkins found that administering buprenorphine in pre-hospital settings was associated with a nearly six-fold increase in the odds of engagement with treatment within 30 days of an overdose. That's why it's so critical to administer this during these situations. Following the executive order that I issued in spring of 2023, the city has been advancing a dual public health and public safety approach to the fentanyl crisis through efforts like the Health 99 post-overdose team and planned post-overdose recovery center, investments in new mobile medication units and dedicated detox beds. Our 2025 budget continues this work by tripling our investments in public health approaches, like expanding access to treatment and funding an additional unit for the Health 99 post-overdose team. You've heard me say on many occasions that we don't treat a health crisis with an arrest public safety strategy, that we treat people who are sick and in need with a health approach. So speaking next is our Secretary of Health, Umair Shah. Dr. Shah will, I want to just personally thank him for his leadership and service to our state, especially during the COVID-19 pandemic and vaccination rollout. He is a committed leader, and we are very fortunate to have him in this state doing this kind of work. Dr. Shah. Hiding from me, Dr. Shah.
Thank you, Mayor Harrell. Thank you so much for your leadership and for your continued dedication to not just the people of Seattle, but in this community for everybody involved. And I just can't say enough about being here today with colleagues at this fire station. It just reminds us of the ever importance of health and well-being for people. And that is the most important piece of this. My name is Dr. Umair Shah. For those who don't know, I'm the Secretary of Health for the great state of Washington. And I can tell you from 2018 to 2023, in just 5 years, the opioid crisis claimed over 9,000 lives, 9,000 people across Washington who are no longer with us because of this challenge in our state. And Mayor Harrell is right to say that we have to do everything to work together, to bring people together, and to have the policies and the resources to connect all of those dots so we can do everything to move things forward. Our department is grateful to the incredible counties and fire departments and teams for joining the pilot program, and for helping to reach more Washingtonians in need. The expansion today that we're talking about is not just paramedics, but also to include EMTs by Seattle Fire is such a critical part of this ongoing effort. As the mayor has said, this is not just about Seattle and our state leaning forward. This is also showing a path forward for other communities across not just our state, but across the country, and really proud of being part of this effort. Mayor, thank you so much. As you know, the program has the potential to reduce the burden on our hospitals that are already concerned, and also the difficulties that emergency services play as we try to give medications to treat not just opioid addiction, but opioid use disorder, OUD as it is known. We know that medications for OUD, such as buprenorphine, are some of the most effective interventions to save lives from overdoses for people across not just our state, but across the country. So this pilot aims to really bring the medications, not to have people come to the medications, but for us to bring the medications to people. And I can't say enough about Seattle Fire and Chief Scoggins, who's going to be speaking next, as well as Dr. Sayre and others who have just been so instrumental in thinking about how we can move this work forward. This is one of many efforts, and as you know, Governor Inslee in this administration has really made it a priority to recognize not just behavioral health issues, but also the real concerns that we have with opioid use disorder across our state. It's important for us to continue to work together. As you also know, that I made an announcement recently that I will be stepping away as the Secretary of Health effective January 15th. And as I leave, I look back on this incredible work that we have accomplished to date, including our Be Well Washington initiative that really reminds us of the importance of not just the physical health and the nutritional health, but also the emotional and spiritual health that all of us as Washingtonians have to be working together on. And we'll also recognize that this takes an incredible amount of teamwork, and I can't say enough about our programs and our teams at the Washington State Department of Health who came to me and said, this is something we need to be doing, and I said, absolutely we need to be doing this because we have great partners on the ground. Thank you, Mayor. Thank you to your teams, and also recognizing the absolute importance of working together as we continue to move forward. So I did want to just close by saying one other thing, which is that we have a number of counties across the state that are engaged in different activities, but I will tell you that Seattle Fire and Seattle and King County have been leaders that have been recognized across the country. We want to continue to work with them to pilot these kinds of programs, but also recognizing that ultimately we have to work together. This is not an issue that is going to go away immediately or very quickly. This is an issue that's only going to be addressed if we work together. So with that, let me introduce Chief Scoggins. Thank you.
Well, good morning. My name is Harold Scoggins, and I'm honored to be the fire chief of the Seattle Fire Department. And I'd like to welcome all of you to Fire Station 10. And just so you know, this is the busiest station in our system. Our firefighters at this station and all of our stations work extremely hard serving the community each and every day. You know, part of our vision is we're a national leader in the things that we do, and we do it with excellence. And what you're seeing today is a bit of that. This ties into our Medic One program, which is the first, in the nation, our energy response team that we launched just a couple of years ago. And this is another program that we believe is really going to make a difference. I'd like to start by welcoming our Washington State Secretary of Health, Dr. Shaw. Welcome to Fire Station 10, which is home to our department's hazmat team. You see the vehicle back there. So we do a lot in our different fire stations. To Mayor Harrell, thank you for your continued support of the Seattle Fire Department's mission to provide the best possible care to the community. And Mayor, this really ties in with our One Seattle vision, because it wasn't one department that made this happen, it was many partners around the community that makes this happen. As the Mayor and Secretary mentioned, we are here today to announce the expansion of our buprenorphine pilot. In February of this year, we announced that our firefighter paramedics had approval to begin administering buprenorphine. And since then, the Washington State Department of Health has authorized the Seattle Fire Department to expand this pilot to our firefighter EMT rank, making us the first in the nation with the program in place to allow firefighter EMTs to administer this medication in the field. And you need to know that significant. I want to personally thank Secretary Shaw for his leadership in prioritizing the health of the people of the state, and for providing the Seattle Fire Department authorization to expand our life-saving by the use of this medicine. Seattle firefighters and EMTs and firefighter paramedics are responding to, on average, 14.2 overdoses every single day. So it's significant. As the Mayor mentioned, we currently have 38 firefighter paramedics that are trained to give this medication, and now we have 11 firefighter EMTs which are now trained to give this medication, for a total of 49 in the department, and we're already seeing a difference. Through December 9th, 48 patients have been treated by the Seattle Fire Department with this medicine, buprenorphine, and as the Mayor mentioned, our most recent case was just yesterday, given by our EMTs, so we know it can make a difference. Three of the 48 doses were administered by EMTs. High-level statistics are important to share, but so too are the personal impacts we've seen this medication have on our patients. I'd like to share a testimonial from the field. Our post-overdose response unit, Health 99, responded to an overdose for a young man with a history of prior overdoses in the past. Upon assessing the patient and finding him with withdrawal, Health 99 requested a medic unit. The firefighter paramedics arrived and administered oral buprenorphine. The patient was subsequently transported to the hospital for further treatment. Following the response, Health 99 team coordinated with the provider and social work team at Harborview to remain engaged in the client's care. I mean, they reached out, they followed up, and they wanted to continue the connection point. The following day, Health 99 outreached the client in the community and transported him to a clinic where he received a substance use disorder evaluation and a long-acting injectable form of buprenorphine. I think that's about 30 days. So the first dose got him there, and the second dose allowed things to continue to happen. Thanks to the stability provided by the long-acting medication, the patient was able to secure stable housing and now secure employment. That's the difference we want to make. This is one example of the many that demonstrates the effectiveness of this medicine on a person's outcome in life. The case managers and firefighter EMTs who work on our Health 99 unit are specially trained to deal with scenarios such as this. And I'd be remiss if I didn't acknowledge the team that actually launched the program in the field. Riley, who's here, is one of our case managers, riding on Health 99 on day one, and Lieutenant Roger Weber and Raul Deming, firefighter Raul Deming, who couldn't be here today. But when we launched this program, they were the ones who drove the vehicle out and responded on the first emergencies. Since its launch in July of 2023, the Health 99 post-overdose response unit has responded 752 times in the field. Of those, 629 were for overdoses. They've distributed more than 600 doses of naloxone and leave-behind kits to patients, friends, and bystanders. The work of Health 99 team is critical to improving the health of those in our community who struggled with this substance use disorder. I thank each and every one of our members who do this highly emotional and taxing work. We were pleased to see that the additional Health 99 was approved in the 2025-2026 budget. I want to thank our mayor and our city council for your ongoing support. And next, I'd like to introduce Dr. Michael Sayer, who is a doctor in the emergency room at Harborview Medical Center. but most proudly, he's our medical director here in the Seattle Fire Department. Dr. Sayer.
Thanks, Chief Scoggins, and I want to echo the thanks to the Secretary of Health, to Dr. Shaw, and to the Mayor for making this program happen. But really, it's about the crews on Health 99 and the firefighter paramedics who are responding to work with these patients every day. As has already been noted, buprenorphine is a safe and effective medicine for patients who are suffering from opioid use disorder. It works by tightly attaching to brain cells to eliminate the cravings that patients experience for fentanyl or other opioid drugs. Regular use of buprenorphine cuts deaths in half among people who are addicted to fentanyl. A big challenge for people who are using fentanyl is that they have to take the drug multiple times a day. And that means that getting started on buprenorphine is tough because it will cause severe withdrawal. And that reality is a big barrier to initiating treatment. Seattle Fire and Medic 1 EMTs and paramedics evaluate 10 to 15 patients, as you heard, every day who have received naloxone to reverse a fentanyl overdose. That naloxone commonly causes sudden and severe opioid withdrawal with vomiting, sweating, and other symptoms. Our crews can measure the severity of the withdrawal just using a simple scoring system, and if that score suggests that the patient is in fentanyl withdrawal, then that's a perfect opportunity to start buprenorphine, because the buprenorphine can effectively treat the withdrawal symptoms. If the patient agrees to try buprenorphine, our trained EMTs and paramedics give 16 milligrams, which is 2 strips, under the patient's tongue, along with a piece of sour candy, and we make sure that they tell us which flavor they gave the patient, so that just shows the attention to detail. And that generates a bit of spit to help dissolve the strip. That buprenorphine is absorbed rapidly, travels to the brain through the bloodstream, and then tightly attaches to the brain cells, kicking off the naloxone and treating the acute withdrawal. Within 5 to 10 minutes, the patients start to feel better. Our crews then reassess, and if necessary, give a 3rd dose of the buprenorphine at that point. Unfortunately, this window of opportunity to start buprenorphine does not last long. The naloxone is pretty much gone by 45 to 60 minutes, and that window closes. So if the EMTs or paramedics are not able to start buprenorphine treatment, the patient is usually out of withdrawal by the time they arrive at the emergency department. If, on the other hand, patients take just 1 dose of buprenorphine, they're protected from overdose for 24 to 48 hours, and we count that as a win. When patients have the buprenorphine in their system, they're not craving more fentanyl, and a conversation can take place about potential for long-term treatment. And while not everyone will agree to long-term treatment, some patients, as you heard, are willing to go and get into a treatment program. We're continuing to work closely with Public Health Seattle King County to measure longer-term outcomes for our patients that have been treated with buprenorphine. We're confident that this program will change lives for the better. Thank you. And I'd like to introduce Brad Feingood from Public Health Seattle King County. Brad?
Hello, everyone. My name is Brad Feingood. I'm with Public Health Seattle King County. What you see behind you and in this room today is leadership and courage. And just a huge thanks to Mayor Harrell, who's never wavered in his approach to treating the overdose epidemic, leading with a treatment, evidence-based approach to be able to help people. What you're hearing about today is what is truly a public health approach to our overdose crisis. What we've attempted to do in partnership with the whole community, with medical providers, with treatment providers, is build out the continuum of services that are appropriate for people who are suffering with substance use disorder. We have bold medical leadership in our community that has really built out this approach. As the mayor said, a number of months ago, we were just down the street at the former DESC shelter that is soon going to be a post-overdose receiving center. So when people get started on buprenorphine, they'll have a place to go. What we've continued to see is by being able to build out this approach, this evidence-based approach, we will continue to see success. Just recently, earlier this year, the first of this year, we started our 24/7 buprenorphine hotline where people can call and get access to medication on demand, removing barriers. Since the beginning of the year, we've had over 500 people get started on buprenorphine medication just by a phone call. This is the next step in the continuum of eliminating barriers, bringing services closer to people. So when people are seen in the field, they can get access to life-saving medication. And then, as Dr. Sayer said in his anecdote, then people can be connected to the next level of service. So on behalf of Public Health Seattle-King County, we greatly appreciate the partnership with the city and the county, bringing services like the post-overdose receiving center, like the crisis services that will be stood up over the crisis care centers that will be stood up over the next couple of years to the individuals of this county, so we can continue to reduce the overdoses that we've started to see in this past year. Thank you very much.
Yes. Hi, good morning. My name is John Ehrenfeld. I'm the program manager for Mobile Integrated Health with Seattle Fire. I oversee the Health One programs. And I, of course, want to echo our deep thanks to Dr. Shaw and the Department of Health for their approval and their partnership on this, the Human Services Department, the Mayor's Office, of course, for their leadership, IAFF Local 27 and their membership, and Public Health King County, as well as our many community partners. We'll shift in just a moment to Q&A, but I do want to quickly say, we get asked a lot, why EMS? Why is the fire department in this role as opposed to, say, a healthcare organization that's hospital-based, an outreach provider, a substance use treatment provider? And we think the answer is that fire has a certain niche that it can fill in this crisis. We know where the overdoses are. We know when they're happening and where they're happening. We can get there very quickly. As Dr. Sayer mentioned, there is often a very short window of time to start this medication, and so fire EMS is particularly well positioned to give this first dose of buprenorphine when clients are in that immediate withdrawal period. And then from then on, pass it to a partner. And I think it's very important to think of this program as one link in a larger chain. So we talk a lot about cascades of care. Historically, often this area has been very fragmented and very broken in terms of silos. And I think what we are building now is a larger system that can really wrap around our clients, our patients, and deliver them both the immediate service that fire is well positioned to, as well as longer term services from our partners in homeless outreach and housing and SUD treatment, et cetera. It's also a very evidence-based program working with our partners at Harborview and at Public Health Seattle-King County. We are instituting what we think is a really evidence-based approach to immediate treatment of substance use disorders. And then, as Brad and Chief Scoggins and Dr. Sayer mentioned, on the horizon for us is working more with our partners and with the city and DESC on the post-overdose center. We hope soon to be working with the Orca Center. We're going to be fielding a new follow-up element in this team, a case manager who can go out 24 hours after the overdose and continue that engagement with the patient, as well as partners such as Valley Cities, DESC, and many others working out there. So I just wanted to reiterate again my thanks to all of our partners, and also particularly our team members on Health 99 who are out there in the field doing this incredibly valuable work on a day-to-day basis. Thank you.
Thank you, John, and thank you, our partners at the county. They mean a lot to us. They are out in front saving lives, and Dr. Sayer and Dr. Shaw, thank you so much for being with us. And right now, we'll close it out unless there are some questions. Again, we're very proud of this work. And again, I want to double down on our thanks to the fire department. I should have screwed up. I have a coat that the fire department gave me. I should have worn that coat this morning. I apologize for that. But if there are any questions, again, thank you for being here. Yes, sir.
A question for Dr. Sayer or Dr. Shaw. Can you talk a little bit about how buprenorphine is used in this kind of acute situation as compared with use as a maintenance medication that people take daily or weekly for a long period of time? What is the indication for it?
Yeah, so basically what we're doing is just getting them started on the medicine. And we're giving a pretty high dose to start with of 16 milligrams because there's so much fentanyl in many of these patients' systems, they really need a lot of buprenorphine. So over time, they may continue to need a high dose and then slowly get it tapered. Some people really may be on the medicine for years. It's a bit like having high blood pressure. You get the high blood pressure, and maybe if you exercise and lose a ton of weight, you might not need medicine anymore, but most of us aren't that lucky, and you're on medicine for many years. So I think what we're doing is beginning this journey, just trying to think about how we can help patients get on the medicine.
And just to follow up, then is the goal to keep them on some kind of on this medication on a maintenance basis, or is there value in a one-time dose in that setting as opposed to?
So we think there's definitely value in the one-time dose. So in the sense that it's going to be in the patient's body for a day. And if they use more fentanyl, they're not going to overdose because the buprenorphine will actually protect them from overdose in addition to reducing the withdrawal cravings. But what we really want, of course, is for some patients to get into a clinic and get on long-acting type treatments, either an injectable form or the strips under the tongue.
Are you finding a lot of buy-in from people who are overdosing with fentanyl? I mean, I know the statistic was 48 people who received this. What kind of buy-in did you get from those 48 people who came in versus how many people kind of said, I'm good?
Of course, there are many patients that are not ready yet. Sometimes people overdose accidentally. They didn't know they had fentanyl mixed in with their other whatever they were using, cocaine, methamphetamine, something else. So they're not truly addicted to fentanyl, and buprenorphine may not really be needed for them. Other patients, maybe they're not quite ready. And one of the real skills that our Health 99 team is developing, and one of the reasons I'm so excited to partner with them, is they're getting really good at helping the patient get to yes on being willing to accept this medicine. It's pretty scary. Imagine, you're outside and all of a sudden you wake up and it's raining and you feel terrible and you really don't know why you're there. Because you're a regular user of fentanyl, you've used it hundreds of times, and now all of a sudden you're unconscious and all these people are standing around you in uniforms. It's pretty scary. Many people just want to bolt. They just want to run off. And our teams have developed real good techniques for helping that patient feel reassured that we're here to help them and to help them get to yes to take a dose of the medicine.
This might be for Dr. Shaw. What are some of the regulatory and legal hurdles to getting this approved? Why is Seattle so far the only department to do this?
Yeah, well, thanks for that. And Dr. Say, I just wanted to add one quick thing to the previous questions, which is that sometimes these are the first and only opportunities you have to connect with an individual who has a substance use disorder. And so it's really important for us to then be able to connect them into care. And I think that's a really important piece of this, is that this is that element oftentimes that we don't get in the healthcare system. And so what you're seeing here is that notion of how do we connect in the healthcare system on a first approach that's happening on the streets or in a neighborhood or in a community. As for your question, I think that has been one of the challenges that we have, is that we do have, for the important reasons, a number of regulations that come in play that our team had to work through in order to be able to provide a pilot program to advance the work. And what we want to do is really, one, to see the effect, and also, and this is why Seattle Fire is such a great leader and partner in this, to be able to monitor what's happening. We're obviously working with Public Health Seattle, King County as well. You already heard from Brad about this, is how do we continue to see the value proposition here? And as we see that value, we now are then comfortable with being able to approach this with other communities and other counties. Now, there is a process that other communities can go through, and they know how to do that. We've been working with some, as you know, with paramedics in other communities across the state as well. But it's really about the regulations that are in place to be able to protect people while we're also trying to advance the innovations that allow us to impact the health and well-being of people as well. And I wanted to, Mayor Harrell, I forgot to do this earlier. I did want to give you a Biwawa apple. It's not one to eat, but it's one to actually squeeze for a little bit of that stress as part of that emotional well-being and spiritual health that we have as well. And I also wanted to thank Lacey Fehrenbach and Kristen Peterson on both our prevention and policy teams, their teams, who many are here, who've done such an amazing job, Mara, to work with our community partners and partners at Seattle and King County. And I just want to thank you for your leadership, your teams, and everything you've meant. This is really an opportunity for us to continue to progress and advance the work, and recognizing that every single life saved is a life that can then live for another day tomorrow. And so we're really appreciative of all your leadership.
Thank you, Dr. Thank you very much. Thank you very much. Thank you very much for being here. All right, this will conclude our press conference. Thank you very much.